Right. Welcome, everyone. Thank you for joining today's community information session. My name is Brittany Lobo, and I am the Community and Family Health Section Manager with Sonoma County Department of Health Services with the Public Health Division. I'll be helping facilitate today's information session. Before we get started, I would like to introduce our panel. I have Carly Moore here with our tobacco and nicotine prevention team, who will speak to what we're seeing in the retail environment. Dr. Stacy, our now outgoing interim health officer, will be joining us to talk about the public health concerns related to non-medical inhalation of nitrous oxide. And Therese Vogue, our health program manager for Healthy Communities, will give an overview of the current legal landscape and why we are considering local action. Then I'll come back to describe what the proposed ordinance would do and what uses would remain allowed. Today's session is intended to be informational only. Our goal is to share what we are considering, explain the concerns that led to this proposal, and hear questions and feedback before the item is considered by the Board of Supervisors. Please use the question and answer feature throughout the presentation to submit questions or comments, and we will address all questions at the end of the session. So today we have 4 main goals. First, to share basic information about nitrous oxide and the public health concerns related to non-medical inhalation. Second, to explain the current California legal framework at a high level. Third, to describe the local ordinance that we are considering in Sonoma County. And fourth, to answer questions and hear feedback from community members, retailers, businesses, and community partners. Our intent is to keep the presentation portion brief so that most of the session can be used for questions and discussion. So what is nitrous oxide? Nitrous oxide has many legitimate uses, including medical, dental, culinary, automotive, industrial, and research uses. The county's concern is not with those legitimate uses. The concern is the growing retail availability of products and accessories associated with non-medical inhalation, including large capacity and flavored products sold in settings where they may be paired with inhalation-related accessories. For more information about what staff are seeing in local retail settings, I will now turn it over to Carly Moore, Senior Health Information Specialist with our Tobacco and Nicotine Prevention team.
Thank you, Brittany. These photos show examples of nitrous oxide products observed in the retail stores throughout Sonoma County. They're not intended to characterize every retailer or every sale of nitrous oxide. What stands out are product features such as larger canisters, flavors, colorful packaging, and marketing that may appeal to recreational use rather than traditional culinary purposes. Next slide. These products are sometimes displayed alongside vape products, smoking accessories, or other items associated with inhalation. When products are marketed or displayed in this way, it can blur the distinction between legitimate commercial uses and products intended for recreational inhalation. These observations are one of the reasons local jurisdictions have begun evaluating whether additional safeguards are appropriate. Next slide. Next slide. These examples illustrate, go back one slide. These examples illustrate why Sonoma County is considering local policy options. The goal is to provide retailers with clearer expectations, support consistent enforcement, and reduce sales practices that may contribute to non-medical inhalation while continuing to allow legitimate commercial and professional use. Next slide. This slide shows accessories that are commonly associated with inhalation of nitrous oxide, including balloons and mouthpieces. These examples were observed in local retail settings where nitrous oxide products were also being sold. And while these items are not necessarily unlawful by themselves, displaying or selling them alongside nitrous oxide products may indicate that the products are intended for recreational inhalation rather than for legitimate commercial purposes. Dr. Stacy will now speak to why non-medical inhalation raises public health concerns.
Yeah, thank you. So federal health officials have warned consumers not to inhale nitrous oxide products. And some of the adverse health effects of these products are loss of consciousness, numbness, trouble walking, vitamin B12 deficiencies, which affect the nerves, paralysis, and in severe cases, death. These warnings are important because some products are available online, as we just heard, and in retail settings, including smoke shops, vape shops, gas stations, and convenience stores. And the county's role, our role, is prevention focused, sharing information, reducing risk, and supporting a clearer local framework. Next slide. And so the health risks of non-medical inhalation can be immediate and serious. Because nitrous oxide can displace oxygen, it can impair judgment. And so both of these things really increase the risk of injury, loss of consciousness, impaired driving, or sometimes even death. Repeated or heavy use can also contribute to vitamin B12 depletion and neurological symptoms, including numbness, nerve damage, and difficulty walking. And these risks can vary depending on the amount used, the frequency of use, and the setting in which they are used. And so if you have any concerns or complaint or general question after today's session, please contact the county using the phone number or email listed here. We're documenting questions and complaints so we can better understand community concerns and provide follow-up information as needed. And for anyone looking for treatment or substance use support, the behavioral health main line is listed here, along with an email contact for substance use prevention resources. You can also search Sonoma County treatment online to find current county treatment and information and referral options. I'll turn it over to Therese Vogue to address some of the local safety concerns, including reports involving impaired driving, as well as the current law and why we're considering local action.
Great, thank you, Dr. Stacy. Well, these pictures don't lie. There are definitely problems with inhalation, non-medical inhalation, and of course they can be immediate and serious. And as Dr. Stacy noted, that this displacement of oxygen can cause somebody to literally pass out at the wheel if they're using it while driving. And there have been cases of people using this while driving, as you can see from the picture there. Heavy use can also contribute to everything that Dr. Stacy said, and including a compulsive addiction that causes somebody to, for example, use nitrous oxide while driving. And next slide, please. So California, of course, does have some laws around nitrous oxide already, but there is a need for clearer oversight. The relevant provisions in California law are found in the Penal Code sections 381B through E. So at a high level, what California law does currently is it criminalizes the possession of nitrous oxide when people are using it with the intent to inhale for intoxication. It prohibits selling nitrous oxide to minors, and it's unlawful for people to knowingly supply nitrous oxide when it will be used unlawfully under certain circumstances. The state law also addresses certain distribution practices. For example, a person who dispenses or distributes nitrous oxide for a legitimate use may be required to maintain transaction records and provide purchaser warnings. There's also a provision addressing more serious situations where a person dispenses or distributes nitrous oxide, knows or should know it should be or could be used unlawfully, and the person receiving it then causes great bodily injury or death to themselves or another person. These are similar to what the laws are with alcohol sales. So importantly, these state laws preserve some legitimate uses. For example, medical and dental administration are exempted when provided under the direction of a licensed practitioner. State law also preserves food-related use of nitrous oxide as a propellant. But the reason Sonoma County is considering a local ordinance is not because there's no state law. Rather, the county is considering whether a local ordinance would provide clearer expectations for retailers, for enforcement partners, for the public, and particularly in retail settings where products and sales practices raise concerns about non-medical inhalation. Next slide. So this is not the first step in the county's response to this growing problem. We have received complaints from the community about severe addictions to nitrous oxide and how it being readily available in local smoke shops, for example, has been a factor in the addiction building. Our public health department, which we inspect local smoke shops for tobacco retail licensing purposes. And we, as shown earlier, we have been tracking the problem and the growing presence of these products. Because of this, the Sonoma County Department of Health Services has sent 2 notices to tobacco retailers, one on March 11th and one on June 16th. These notices explain existing state law, age restrictions, lawful uses, and product characteristics or sales practices that may raise concerns. The outreach has emphasized education and compliance and public safety. If an ordinance is adopted, the county expects to continue retailer and community education so that businesses understand the requirements before enforcement becomes the primary focus. And with that, I'm going to hand it back to Brittany.
All right, thank you very much. The proposed ordinance, as outlined today, would restrict retail sales and distribution of nitrous oxide products and dispensing devices in certain settings. It would, as we have been saying, also preserve lawful medical, dental, culinary, automotive, industrial, research, wholesale, pharmacy, and other authorized uses. The intent, as Therese mentioned, is to create clearer local expectations, support education first implementation, and coordinate enforcement when needed. The ordinance is not intended to limit legitimate business or professional uses. So this slide is important because we know many participants today may represent, excuse me, businesses or professional settings where gases are used for legitimate purposes. The proposed ordinance is focused on nitrous oxide, or N2O, in retail sales contexts associated with non-medical inhalation. It does not apply to nitrogen or liquid nitrogen, which is N2, and is used in different applications. The ordinance would not apply to lawful medical or other culinary, food-related, industrial, or other authorized uses, as we have stated. If you have a case-specific question about how an exemption would apply, we may need to track those questions and follow up after the session, but we would encourage you to put those questions into the Q&A so that we can address them during the discussion. And with that, I want to thank everyone for participating today and open it up now for questions and discussion. We welcome questions about retailer education, any exemptions for legitimate use, timing of implementation of the ordinance, any questions about our enforcement approach, or any community concerns that you may have. We may not be able to answer all of your legal or case-specific questions today, but we will certainly track themes and follow up with individuals as appropriate. So I'm going to open up the Q&A and we will be answering questions live. You are also able to raise your hand and we can have you come off of mute if you would prefer to ask a question verbally. There's a question here about retail sale authorization. Therese, can you take this question?
Um, yes, let me see where I need to find the question.
Let's see. I'm saying we'll answer it live. Why are retail sales authorized at all as opposed to wholesalers who have tracking requirements?
Okay. Yeah, this is where we get into why we're proposing a local ordinance, because state the existing penal code is really focused on the user. There is some mention of sales practices, but it has a pretty high bar and that you would have to prove intent. So that's why we're considering this, and why many other jurisdictions have actually passed local bans, because it kind of leaves the retail sale not as highly regulated as we would like to see in order to control the illegal, or the not illegal, the use of nitrous oxide in a way that is harmful. I'm not sure if that answers.
Right. The next question, has the county considered limiting packaging so as to preclude the appeal to youth? The same idea as limits on cigarettes. I will defer this question to Therese.
Yeah, this is part of the ordinance. So the proposed ordinance, it would not allow flavored products, and there are some state legislation being proposed as well around not allowing flavored products, but we're tracking those as well. Right now, those aren't going far enough. So but that's definitely something that needs to be addressed as well, because that's what we've seen in the retail environment is the canisters are getting larger and they're coming in flavored packaging and very kind of kid friendly, makes it sound like it's fun and not harmful. So this is definitely something that we want to see addressed.
Yeah, and here is an example of what Therese was just mentioning. This is a rather large nitrous oxide canister. This one is 2 kilos of gas, and it is called Geek Whip, and it is watermelon splash flavored. So yes, these kinds of products we know are out there in our community, and are very harmful for youth. So part of what we are trying to address with the ordinance is this kind of product.
Yeah, and I'll just say, even the word geek is a code word for getting high off of. So they've kind of captured everything with the packaging, the flavors, the colorful products, and the actual naming of the product. Yeah.
Great. And the next question here, who are the producers of these harmful retail products? Why not go after them? I don't know if we can speak potentially to any state level or federal level actions that are being pursued around wholesale manufacturers of nitrous oxide, given the limited scope of what we can do as a health department within the county of Sonoma unincorporated areas. We don't have a lot of control over manufacturers, but I do think that there are some growing movements around at least the state or the federal level around addressing this at a higher manufacturer level. And Therese, do you have any information about that, or should we take that back?
Yeah, we can take that back. I agree that this would be something that the state would need to regulate and enforce. But there might be some opportunity to do more local enforcement if there were a manufacturer in our county, but chances are these are coming from overseas and such. Yeah.
Right. Next question. Why isn't the approach to encourage the state to adopt clearer regulations as opposed to having individual communities adopt multiple regulations? Is there state resistance? Our team has been tracking very closely a number of bills at the state level related to the regulation of nitrous oxide. Teresa, I would love for you to speak a little bit about the complications locally in terms of enforcing statewide regulations. But if there are bills that we might want to highlight for our participants in the webinar here today to understand a little bit what's going on at the state level, that could also be helpful.
Yeah, sure. Yeah, we have been tracking the state bills. A lot popped up this legislative session. There's four of them right now. Um, Two that seem to be a little more comprehensive, but they're kind of just not quite all the way there. You know, one of them is exempting the small little whippets right now. One of them was only going to apply to smoke shops. They recently added in convenience stores. So you can see that while their attempt is to be comprehensive, they're just not quite there yet. And that's why I think local jurisdictions have said we need something that is fully comprehensive, because we know at a local level it'll be playing whack-a-mole, because you may close it down here, but it will pop up over here in a different type of store. So we are talking to the legislators and making our needs known so that they understand what's going on at the local level and can incorporate those changes into the existing laws. So that would be wonderful if the state were able to come up with something that was very comprehensive. So we are definitely tracking that. The other issue is when it would go into effect. Right now, any law passed in the 2026 cycle would go into effect in January 2027. For some of us in local government, that's not soon enough. But yes, a state solution would be preferred, but right now the ordinances that are in queue here aren't comprehensive enough. And then it's, you know, what we do have already in the California code is in the penal code. So some of what's being proposed is to have health and safety code, so that a violation could be of a health and safety code or a business and professional code as well. So it could add some structure that we would find easier to access if we were trying to do local enforcement. But right now, none of that is in place and none of it's passed.
Great. Thank you, Therese. All right, let's see. The next question I'm going to move to here, which ties a little bit into what you were just saying, Therese, is why not ban retail sales completely in Sonoma County? I think you said that has been done elsewhere. I'm not sure if this is referring to not allowing any legitimate uses, like banning all sales, or if it refers to the entire geographical area of Sonoma County. So we only, with our Board of Supervisors, have jurisdiction over the unincorporated areas, but our team has been working very closely with all of the cities and towns within Sonoma County, and there is a strong interest in a coordinated approach across our counties so that the same retail restrictions would go into place across the entire geographical region of Sonoma County. That will take a little bit of time, as every city needs to pass their own ordinance. But as I said, we have been in coordination with them. And we do want to make sure that we continue to preserve legitimate medical, dental, and culinary uses of these products, while addressing the non-medical inhalation problem that is growing in our community. I don't know if you have anything to add, Therese, to that. Okay. All right, and then next question here, what is the correlation, if any, of nitrous oxide use/abuse and other substance abuses by the same audience? And I'm actually going to ask my colleague Shelley Alves, who heads up our substance use disorder prevention unit here at the County Health Department, to speak to that. So Shelley, you should be able to come off of mute and help us answer this question.
Got it. Can you hear me okay, Brittany?
Yes, thanks, Shelley.
Okay. Yeah, thanks for the question. I would say it would be hard to identify a direct correlation for a whole group of people. So looking at the individual, I'm sure this is the case for many people. I wouldn't say it always means that if you're abusing one substance, it could lead to another substance, but If you are abusing one substance and become dependent on that substance and experience tolerance, that is going to put you at a higher risk for continuing on to other substances and misusing other substances at times. But I wouldn't want to stereotype a whole population and everybody that may misuse nitrous, but I would say if you're using one substance, you're at a higher risk of progression.
I could, and then one thing I would just add to that, totally agree. And when these are used, in a party setting where there likely are other substances potentially being used, like particularly combining nitrous oxide with other sedating substances like alcohol, opioids, can really increase the risk of that respiratory depression, leading to loss of consciousness and, increasing the chances of actually having respiratory failure and dying from the use of nitrous oxide combined with other things. So it really increases the potential harm when these substances are when nitrous oxide is combined with other substances, particularly those that are also affecting sedating and affecting respiratory, the respiratory drive.
Thank you for adding that in. All right, we have one last question here. Please, if you have questions, feel free to add additional questions into the Q&A. I'm going to answer this one live. I'm confused as to why a tobacco retailer is selling these products. Have there been any complaints about access and availability for legitimate uses that would necessitate them being in a smoke shop? I have not heard of any issues with access to nitrous oxide for legitimate professional uses. So I don't have an answer really to that part of the question about any complaints about access and availability for legitimate uses. This is, another product that fits into the general line of products that smoke shops tend to offer. And I see Therese has more to add.
Yeah, I'll just add that we did connect with some restaurant supply and other organizations that service restaurants and bars, etc., with nitrous oxide. And what we understand there, yes, again, there is no problem with getting that gas, and that they get those restaurants that need it, they get that gas from the wholesale producer, not from a smoke shop. So we have heard stories that smoke shops say, "Oh, I sell this to Starbucks," but from our investigation of that's not where these restaurants and coffee shops and etc. are getting their supplies that they need for their legitimate uses. On the other hand, we have had several complaints from people saying that they have either themselves or a friend gotten severely addicted to nitrous, and that they have bought their supply at local smoke shops. Mm-hmm.
Great. Thank you. That concludes all of the open questions in the Q&A. Again, if you have any additional questions, please go ahead and put them into the Q&A or raise your hand so that you can come off of mute. And the panel and I can stay for a few more minutes to make sure that we've answered everyone's questions. This whole session is being recorded and will be posted to our website so that the information can be made available to folks who were not able to sign on today. All right. I thank you all very much for your time and for attending, for your interest in this issue. Again, if you have any questions, I'm going to put that slide back up here. If you have any questions, concerns, complaints, or need any treatment resources, there are a couple of email addresses and phone numbers here on this slide that you can use to get in touch with us. You're also welcome to reach out to any of the panel members, and we will do our best to answer any questions that you may have. All right, team, I'm going to wrap us up. It looks like no more questions are coming in. Thank you to my panel, Dr. Stacy, Therese, Carly, for your time, and thank you all to all who attended for your interest in this topic. Let us know if you have any additional questions. Thank you.